Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for February 21st, 2024. Thank you for joining us this month. Our presenter today is Ashley Buck. Ashley is a second-year PhD student in the Human Movement Science curriculum at the University of North Carolina, Chapel Hill, and is co-chair of the Weight Management Task Group with the Osteoarthritis Action Alliance. Ashley's research interest includes seeking to understand the influence of gait biomechanics and body composition on knee osteoarthritis development in at-risk populations, such as those with obesity and those with anterior cruciate ligament injury. She also seeks to progress novel gait retraining interventions to prevent or mitigate knee OA development, as well as develop patient-centered resources for osteoarthritis and weight management with the Osteoarthritis Action Alliance. She's a member of the Pietrosimone Lab Group and Motion Science Institute in the Department of Exercise and Sports Science. And through her research, she also collaborates with researchers in various departments at UNC, including the Department of Orthopaedics in the School of Medicine, the Thurston Arthritis Research Center, Gillings School of Global Public Health, and in the Joint Department of Biomedical Engineering at UNC and NC State University. The title of today's presentation is Evidence-Based Dietary Practices for Osteoarthritis Management. Welcome, Ashley.
Awesome. Thank you, Nick, for the introduction, and thank you, everyone, for joining today. As Nick said, I'm going to be discussing evidence-based dietary practices for OA management. So to give an overview of today's presentation, I will begin by discussing the impact of OA and current self-management recommendations for individuals with OA. I will then discuss patient-reported beliefs and interests surrounding nutrition and diet to manage OA, followed by the current state of research for nutrients and diet in OA management. Lastly, I will highlight one of our recent reviews that assessed whole foods and dietary patterns to improve OA outcomes, and I will preview the OA Action Alliance's newest patient resource for reducing joint pain through a healthy diet. To begin, OA is the most common form of arthritis, and it affects about 1 in 7 adults in the United States. It's estimated that by 2035, over 70 million adults in the US will be diagnosed with OA. OA is also a leading cause of disability, and this comes with significant personal burdens and affects the overall quality of life for those affected. OA is a chronic and progressive disease, and there is no cure or effective disease-modifying drug therapy right now. And so that means current interventions largely focus on risk factor modification, including weight loss or injury prevention, along with symptom and disease management. It's also of note that most OA intervention strategies emphasize patient education and self-management approaches overall. When we consider the OA management strategies and self-management strategies, I think it's important to highlight the distinction between OA illness and OA disease. And so essentially, OA as an illness refers to everything that the patient experiences, or sometimes called symptomatic OA. And so this includes pain, symptoms, stiffness, changes in function, and mobility. Whereas OA as a disease is considered to be radiographic or X-ray evidence. So this is progression of joint space narrowing, cartilage thinning, and development of osteophytes. And it's imperative to treat the illness aspect of OA to reduce the personal burden again and improve the quality of life for those who are affected. There are some pharmacological interventions to help manage OA, such as NSAIDs, but most recommendations are with regards to self-management and self-efficacy practices. Some self-management strategies include physical activity and exercise, dietary modifications, weight loss, and physical therapy. So as you probably guessed, the primary self-management strategy that I will be discussing today is dietary and nutritional modifications, specifically for managing symptoms, reducing inflammation, and promoting weight loss and weight maintenance. Previous research does suggest that dietary modifications, when paired with physical activity, yield the greatest improvements in OA-related symptoms and really do optimize OA management. This is because dietary modifications can also help to promote weight loss and reduce joint loading, as well as reduce systemic and joint inflammation. It's also important to know that patients believe that what they eat impacts how their joints feel and impacts their symptoms. And I really want to highlight this as a key consideration for when we're developing self-management practices, because strategies that highlight high patient interest and patient beliefs are likely to be adopted and sustained by patients better. And previous research has sought to evaluate the impacts of nutrients and supplements, including vitamins D and K, glucosamine, and fish oil on OA outcomes, as well as the impacts of more holistic dietary patterns, including the Mediterranean diet or Western-style dietary patterns. However, the evidence is still a bit limited and conflicting in this nutritional space, and I'll kind of touch on some of those reasons a bit later on in this presentation. But it's also important to consider other factors such as patient education and health literacy, as well as healthcare constraints for discussing these topics with patients, and sociodemographic factors such as access to foods with high nutritional value or access to nutritional specialists for guidance in adopting these new dietary patterns. And so because patient education is a key factor for successful OA management and self-efficacy, the OA Action Alliance conducted a study surveying patients with OA, asking them about specific nutrition education and weight management topics that they were most interested in learning about. So in this study, we surveyed over 300 individuals with OA, and we found that they were most interested in learning about topics such as what foods might make their OA symptoms worse, or foods that reduce their inflammation, as well as information on specific supplements, spices and herbs, whole foods, and dietary patterns. In this same study, we also asked healthcare professionals what they discuss with their patients with regards to nutrition education. And ultimately, we found in this study that most healthcare providers do not discuss the topics in which patients report they are most interested in learning about. We found that healthcare providers tend to discuss topics that are more evidence-based, while patients are interested mostly in topics that want to help them reduce their symptoms. And so after this study, we kind of wondered why this gap in patient education really existed, and what were some strategies that we could do to help close this gap and improve patient education for OA management. One thing we hypothesized was that, again, healthcare providers might not be comfortable discussing information regarding nutrition for OA when there's limited or conflicting evidence in these topic areas. It may also be that there are limited evidence-based resources for healthcare providers to share with their patients that succinctly and comprehensively highlight the potential effects and roles of nutritional and dietary modifications for OA outcomes. So, for example, patients did report interest in learning about nutrients such as vitamins, fish oil, and glucosamine. However, these supplements are not recommended for OA management by the American College of Rheumatology, and this is largely, again, due to the lack of conclusive evidence that supports significant improvements in OA outcomes. There is a notable amount of research that has been conducted on supplements in OA. However, the heterogeneity between the studies is one of the barriers for kind of understanding and implementing these findings into practice. For example, a study could assess a supplementation dose of 50 milligrams, and another study could look at the same supplement in 100 milligrams. Also, the intervention length varies between studies, so there could be a 6-week intervention or a 6-month intervention. And across all the studies, there are a variety of OA outcomes that are assessed. In addition, it's important to consider the health literacy of patients, again, because supplement doses and frequency of consuming these supplements isn't always easily understood by patients or healthcare providers. And access to high-quality supplements is a barrier because finding the pharmaceutical grade supplements that are similar to the ones that are used in RCTs is quite difficult and expensive. And so the overall conflicting evidence and significant personal and clinical barriers might be one reason why healthcare providers did not report discussing nutrients specifically for OA management with their patients, again, despite patients being interested in learning about this. Some evidence, though, does suggest that consuming vitamins and nutrients via whole foods and diet may improve OA outcomes. So, for example, sufficient vitamin D and K consumption in one's diet is associated with decreased OA pain and symptoms. And this might indicate a stronger role of dietary patterns in OA outcomes rather than nutrients individually influencing OA outcomes. So, however, despite the potential role of dietary patterns in OA-related outcomes, there's a lot less research in this space. And again, some evidence does suggest that Western dietary pattern, for example, which is consumption of foods that are high in sugar and saturated fats, is associated with worse OA symptoms and progression. Conversely, the vegetarian diet and Mediterranean dietary patterns have been associated with better OA-related outcomes, including pain, symptoms, function, and mobility. However, a barrier for healthcare providers for discussing the role of dietary patterns in OA management might be due to the overall lack of rigorous reviews and resources for providers to offer informed and evidence-based recommendations to their patients. This might be due to a lack of research studies that evaluate dietary patterns for OA management, especially rigorous studies, because it's quite difficult and expensive to conduct dietary RCTs, for example. And it may be beneficial to compare dietary interventions to normal diet or usual care. However, differences in individual dietary patterns across people likely poses a barrier to understanding the true effects of dietary patterns on OA outcomes. Many studies do utilize dietary recall or nutrition tracking to quantify dietary patterns and nutritional intake. However, these methods allow for some potential biases in participant recall or accurate reporting of their dietary patterns, as well as could introduce measurement error because it's a little bit difficult to define what a medium-sized apple is versus a large-sized apple or serving sizes without close monitoring and documentation by either researchers or participants. So there's a large burden in that space as well. However, regardless of these barriers, there are significant benefits to evaluating whole foods and dietary patterns for OA management because whole foods are likely better understood by patients than specific nutrients and supplements. And therefore, it may be easier for patients to adopt some of these self-management practices compared to nutrients. And given that patients are interested in learning about the role of whole foods, such as nuts and fruits, along with dietary patterns such as the Mediterranean diet, we sought to next evaluate research surrounding dietary patterns for improving OA outcomes to ultimately develop an evidence-based review and create a patient-centered resource that kind of highlights the role of dietary patterns to manage OA. So therefore, we conducted an umbrella review last year. And for those who don't know, an umbrella review essentially is a review of reviews. And the purpose was to review and provide a comprehensive understanding of existing evidence of whole foods and dietary patterns on OA-related outcomes. So things such as pain, stiffness, inflammation, biomarkers of cartilage breakdown, all of the above. And the results of the review would help to inform evidence-based recommendations for healthcare professionals, as well as improving self-management options for individuals with OA and self-management options that patients are interested in learning about. We also wanted to minimize the clinical barrier of interpreting research on supplements and nutrients, as well as identify areas where more research is warranted. So to kind of briefly give an overview of the methods of the umbrella review, we conducted a literature search across 5 databases, looking at whole foods and dietary patterns for OA outcomes. And after the initial search, we identified over 1,200 articles that could be included in our review. We then screened and removed articles that were either duplicates or didn't meet the eligibility criteria, based on title, abstract, or full text, and an overview of the eligibility criteria is shown in that table. And so after screening, we ended up with 5 systematic reviews or meta-analyses to be included in the umbrella review. And it's important to note we didn't include scoping reviews or narrative reviews or commentaries. It was only systematic reviews and meta-analyses. So out in the literature, there are a lot of various other reviews, but we were only able to include 5 in our umbrella review. And for those who are interested, you can probably go back to this slide on the recording as well. But these are the 5 reviews that we included in our umbrella review. Just to give a brief overview of the studies that were included within the reviews, there were 9 cross-sectional studies and 69 RCTs or prospective studies. And the reviews assessed the relationship between OA outcomes, so symptoms, inflammation, pain, with anti-inflammatory dietary patterns, so the Mediterranean diet, anti-inflammatory foods, so fruits and juices and tea, as well as spices and herbs. And based on the characteristics of the studies and reviews, we ultimately categorized the review findings into 3 subcategories of fruits, spices and herbs, and Mediterranean diet. And so now I'll kind of go through the findings of the review. But again, we assessed the associations of fruits, herbs, and Mediterranean diet on things like physical function and mobility, pain and stiffness, OA progression, and inflammation. Starting with the findings of fruit and OA-related outcomes, the evidence relating to fruit intake and OA outcomes was derived from studies that assessed tart cherry juice, pomegranate juice, and strawberry powder. It was found that objective measurements of mobility and function were not affected by any of the fruit interventions. And observational data from one study did indicate that 12 weeks of consumption of freeze-dried strawberry powder daily was associated with small reductions in OA pain and symptoms. But it's important to note this study assessed consumption of what essentially would be the equivalent of 50 to 70 fresh strawberries daily. So I'm not quite sure how feasible that intervention is in real life, but it was also found that no studies assessed the evidence of radiographic progression of OA with fruit interventions, but inflammatory biomarkers were differentially affected by intervention type, and the evidence regarding the effectiveness of fruit on reducing inflammation, though, is largely inconclusive just because of the small amount of evidence there was available. And so collectively, these findings suggest that fruit interventions may induce some anti-inflammatory responses in individuals with OA, but further investigation is warranted given the inconclusive and limited nature of the available data. Next, moving into the effects of herb consumption on OA-related outcomes. This evidence was similar to fruit in that it was limited. Data from 4 studies were assessed. And so one study looked at spearmint tea consumption, and then the other 3 studies were RCTs evaluating the effects of ginger interventions on knee OA outcomes. And so it was found that spearmint tea intake over 16 weeks didn't produce any improvements in OA-related outcomes. But the 3 RCTs that assessed ginger consumption with knee OA, those were 6 to 24 weeks of intervention and compared ginger to a placebo. And the review that assessed this only provided pooled mean differences for the outcomes and found that there were small reductions in pain scores and serum C-reactive protein levels. However, the individual study results were not provided. And so although firm conclusions aren't really possible, again, the summary scores do suggest that ginger may decrease knee OA pain and severity, and some specific inflammatory biomarkers biomarker levels, but again, future research is necessary in this space as well. And then lastly, the Mediterranean diet was the only dietary pattern that was included in the reviews. And the interventions were 12 to 24 weeks. And overall, it was found that there were improvements in self-reported function, WOMAC scores, and AIMS scores, as well as knee and hip mobility. And it was found that people who had better adherence to the Mediterranean diet compared to those who had lower adherence also had improvements in self-reported function and lower prevalence of knee OA and pain and severity. And so overall, these results indicate that there are some beneficial effects for the Mediterranean diet on OA outcomes. So getting a bit more into the Mediterranean diet, patients previously indicated that they were interested in learning about this dietary pattern for OA management. It was also the most studied dietary pattern across all of the reviews in the umbrella review, and data do indicate that the Mediterranean diet is associated with improved OA outcomes. The Mediterranean diet in previous research has been found to yield favorable weight loss results in individuals with obesity. And obesity is a primary risk factor for OA. So weight loss is associated with reduced pain and stiffness, along with reduced joint loading and inflammation. And components of the Mediterranean diet have overall anti-inflammatory effects, and this includes things such as fruits, vegetables, seafoods, etc. And so from these data, the OA Action Alliance developed a patient resource outlining the potential positive effects of the Mediterranean diet for managing OA. And again, I will preview that resource at the end of this presentation, as well as provide a QR code that links the resource to the OA Action Alliance website. But to kind of briefly wrap up before I move on to that resource, overall from the umbrella review, there is still a need for continued research that comprehensively evaluates the influence of whole foods and dietary patterns. And this includes things such as the low-carb diet, for example, or vegetarian diet. And while the observational nature of most of the studies does limit some of the conclusions which can be made, again, due to the large variations in study designs and outcomes assessed, it's important to still conduct these studies with consumer accessible foods, such as whole foods and dietary patterns, to informed evidence-based practice that is a little bit more understandable for patients and easier to implement. And so the results from the umbrella review led us to create an evidence-based resource for healthcare providers to share with their patients that outlines the benefits of a Mediterranean diet for managing OA. And so here's a preview of the nutrition resource that the OA Action Alliance created based on the umbrella review. And again, this is for patients and providers to better understand how components and potential effects can improve OA management. And so one disclaimer really quick is to check with your clinician and healthcare provider prior to starting a new diet or taking supplements. But the QR code on this resource will link you to the webpage version of this, and you can also download the PDF version from that webpage as well. And then I can go back to the resource, but just a few acknowledgements. Everyone at OA Action Alliance, a fantastic group of people to work with, especially the weight management group. So everyone listed there, they all put in a ton of work to help write these studies and write the review, create the resource and all of that stuff. So a huge thanks to them. And then a big thanks to everyone in my lab group in motion science, as well as everyone over in TARC. And so that wraps up my presentation. There is the QR code again for the Mediterranean diet resource. But yeah, thank you for attending. And I think I'll open it up now for some questions if there are any.
Thank you very much, Ashley. I really appreciate it. This is a great talk and very exciting results. I had one question that was sent to me in the first study that you referenced about healthcare providers not being comfortable discussing nutrition information. Was there any sort of breakdown on what kind of healthcare providers were surveyed? Like, were they dietitians or RDNs? Were they physicians, physical therapists?
Yeah, that's a great question. The first thing I'll reference the OA Action Alliance Lunch and Learn webinar. I believe it was in September 2021, where we went into the details of that study as well. But off the top of my head, I want to say it was primarily physical therapists and family practitioners, from what I remember.
Okay. And we had a comment here. It's not really a question, but it's more of a comment about it. I've recently read about the Atlantic diet being considered as useful or possibly more than the Mediterranean diet. And they want to kind of put on the radar of the OA Action Weight Management Task Group that this might be worth researching a little bit further.
Awesome. Yeah, I haven't heard about that one much. So that is definitely something that our group can look into as well.
Going through here looking to see if there's any other questions. Not seeing anything in here for Ashley right now. But if down the road anyone has any questions, you are more than welcome to contact us anytime and we will forward the question along to Ashley. And thank you so much. And thank you to everyone who attended today's presentation. In just a moment, we'll launch a brief satisfaction poll about today's presentation. And please answer those questions before you leave the webinar. And finally, we hope you will join us on March 20th for our next Lunch and Learn titled Psychologically Informed Practice to Enhance Health Outcomes After Sports-Related Injury, featuring Shelby Bays. Thank you and have a great day.